Well, thanks, David, for inviting me here. My talk at the Academy is really on patient satisfaction.
Okay.
And let's define what patient satisfaction is. Patient satisfaction is the expectations of the patient, their needs and desires. And this is something that has really been hard for doctors to sort of come to grips with, because it's the patient's expectations. The doctor expects to do a great surgery and to make your vision great. But then if you don't line them up in terms of what you want to do for the patient and what the patient expects, that's where you end up with a little bit of a problem. And we see patient expectations can be very high. And now that we have online reviews, you can see how online reviews are affecting doctors.
Right.
Online reviews can be a roller coaster ride emotionally for doctors. They get great reviews online, and they can get very poor reviews online. When you get very poor reviews, that does something to your self-esteem, and it really makes you feel pretty bad about yourself. So we want to, at this point, tell you a little bit of how to deal with patient reviews online and how to maximize your patient satisfaction. Things have changed. The patient-physician relationship has changed. Now we have the physician called a provider, and the patient called a consumer. And guess what? Your medical practice now is called a business. Where have we gone? Okay? So these are where the changes have gone, and online reviews are now taking control of where patients are going, because most patients now are looking online to see if their doctor's good enough. And what are they doing? They're looking for positive and negative reviews. And let me explain to you a little bit about a positive review versus a negative review. A positive review, what that does when a patient is looking up a doctor, is that reinforces their idea to see that doctor. But a negative review will actually change the patient's mind to actually see you as a patient.
If you were to name the top 3 things that an ophthalmologist should do to ensure that they have a good review, what would they be?
All right, so the top 3 things is, 1, when you see the patient, smile. Body language is very important when dealing with patients. If you come into the room and don't acknowledge the patient, and that's number 2, acknowledge the patient. If you can acknowledge the patient by name, that's even better. So smile, watch your body language, and acknowledge the patient. Right? And then number 3, make sure you show some empathy and actually address the patient's complaint.
Right.
How many times have you seen where the doctor comes in and says, you have this diagnosis, you have an epiretinal membrane, we have to do surgery, when the patient's coming in complaining about itchy burns? Little disconnect there. So you can see where patient satisfaction can be pretty low. Why? Patient expectations. They're coming in with a complaint, and what they want is, they want that complaint addressed. So I would say those are the top 3. Smile, acknowledge the patient, and then address the patient's complaint with empathy.
If you have a poor review as an ophthalmologist, how should you fix a poor review?
Right. So negative reviews are extremely powerful of casting you in a bad light on the internet, and there's a reason for that. People like to click on negative reviews. When they see something bad, they click on it. Negative reviews tend to go more viral than positive reviews. People tend to like to click on negative reviews because they want to see, well, let me see what happened here. And negative reviews become at the top of the list, and they become very powerful. So how do you prevent negative reviews? Well, the first thing to do is try to prevent them. So take steps in your practice to try to prevent these things. Now, how do you prevent negative reviews? Well, you know which patients are not happy. Now, not every patient is going to tell you, but the most vocal might. So if you have a patient that waited and walked out of your office, that's not the patient to just dismiss. That's a patient to call up, get on the phone, send a little note to apologize, and then make sure when they come back in for their next appointment, okay, that you don't have them wait. So there are ways to do that. Once the negative review is on, it becomes very, very difficult to take it off. The only way you can take off a negative review is if it really is a personal attack on you. If it's a personal attack on you as a doctor, or is defaming you or defacing you, you can go to the publisher of who published that negative review and try to go through their rules and maybe get it taken off. But that becomes very, very difficult. If you know where the negative review came from, you can contact that person. That's the only person that can take off the negative review.
Tell us about some of the broader efforts that the AAO is engaging in to improve patient satisfaction.
Well, you know, I think that the AAO is on the forefront of patient satisfaction. I mean, if you look at the educational material that comes out of the AAO, this is top of the line. This is cutting edge information for the patients to try to help the patients. What we really want is we want the educated patient. The educated patient is going to be more compliant. The satisfied patient is going to be more compliant. And the more compliant the patient, the better the outcome.
If we look at some of the other AAO initiatives like the IRIS reporting database, how does that factor into patient care and patient satisfaction?
Right. Well, you know, big data is a huge thing, and the IRIS registry is on the forefront of that. What that enables us to do is that enables us to look at populations. It enables us to look at populations to make sure that they're getting the correct information about their disease process. And we can follow that over time and see if we get a decrease in the incidence of certain diagnoses. So we look at that as a tool to investigate how we make changes in our treatments and our education to see what effect that has down the line. And I think that's going to be a very powerful tool going forward.
Now, clearly there are some ophthalmological conditions that are more challenging and are more prone to poor outcomes than others. And certainly in areas of macular degeneration, expectations need to be tempered with patients. What efforts can ophthalmologists put into place to set appropriate expectations ahead of time?
Well, that's a really good question. And you know, the word degeneration puts a lot of fear into the patient. That is the one thing I see. Once you mention that word, age-related, macula, and then you say that word degeneration, watch your patient's face and see how they react. There's intense fear. Now, but every age-related macular degeneration patient is not created equal. Some of them have poorer prognoses than others, as you mentioned. Well, some of them may not progress because they may only have the beginning or early forms of it. So this is the time to really make it clear with the patient and tell them that you want to help them. You're their advocate. You're not the messenger to give them bad disease. You're there to be with them for the rest of their life, to take care of their vision and to get them through this. So when I see doctors speaking to patients about macular degeneration, I think what they should say is they should tell the patient, I'm going to do everything I can to help you. And if that means helping you function at a higher level despite the disease, right? So you see patients all the time. They have difficulty walking. They use a cane. So you have a little bit of macular degeneration. You may have some difficulty with your vision. Guess what? We're going to get you through that. We're going to see if we can get you low vision aids and try to help you function at the level that you want.
Right. So essentially what you're offering is a multifactorial view of their condition and trying to emphasize the positive remediation that might be possible.
Yes. Patients, what their concern is and what their expectations are, they want to function at the highest level they can. So you address that right from the beginning. You address their fears. What is your fear? And that's really a communication between you and the patient. If you don't do that early on, then that bond between you and the patient is not there. And you want to develop that bond early on because that's the patient that you're giving the diagnosis to. New patients are the ones you want to develop that bond. That first visit is the most important. because that's going to tell you where your relationship is going to go.
If you compare visual versus verbal aids to communication, which are the strongest and the most important in your mind?
All right, so that's a good question, and what I'm going to have to say to that is every patient is different. There are patients that like visual aids, and there are patients that like verbal aids, and there are patients that do both. A lot of it has to do with, and I tell patients this all the time. I say, you're in this room right now. If I gave you a unicycle and I told you the only way you can get out of this room and go home is you got to go on this unicycle and go out of the room, okay? Guess what? If you're really motivated, you're going to get on the unicycle. It may take you a week or 2 weeks or a month to learn. I'm going to feed you and give you water. You'll be okay, but you'll get out of the room. That's the same thing with patients. If they want to use the vision that they have, or they want to use their other senses to get through life to actually get to the level that they want to function at, they can do it. So it's really the motivation of the patient. So doctors somewhat have to be a little bit motivating. They have to motivate the patient. And guess what? Whatever the patient's going through, there's been someone that's gone through it before. So there are inspirational patients that you've taken care of that they can share their ideas and share what they've done with the patient. I think that the academy is really important by highlighting certain patients and showing what you can achieve with certain eye diseases.
When we look at patient advocacy organization and patient support groups, what role do they have to play in the shaping of patient satisfaction overall?
Yeah. They are very important because there are questions that patients have that they don't ask the doctor. They come up after the fact, or they come up when they're home. That's where these groups play a really large role, where they actually go and can ask the questions that they don't want to ask. They may think the question is too stupid, I can't ask it. But when in these groups, everyone is used to having all these questions, and those questions are actually answered. So I think they play a major role, and they play a role in showing people who have gone through it before. Having someone gone through it, or having someone with the same diagnosis that lives a fulfilling life, is important for these patients to see, and they play an extremely important role.
Professor, tell us if there are any other aspects that you think we should be aware of, new projects, programs, and initiatives in this field.
Well, I think that you can see how technology is just taking off, right? And I see the future just with these driving cars that drive themselves. Imagine, you can't get your license. You can't get from point A to point B. Guess what? Jump in the car, it'll take you there. So I think that technology is really going to change the functioning of patients with low vision and going to get them to go and do things that they think they can't do. Mm-hmm. And I think that's going to be with low vision aids, verbal aids, and just technology just helping out.
So you're recommending that ophthalmologists embrace this new technology, be familiar with it, and guide patients appropriately?
Yes. Yes, I do.
Thank you so much for this wonderful elucidation. I really appreciate it.
Thank you, David.
Thank you.